certified natural medical practitioner based here in London, exactly in Woolwich Arsenal, London. And today, our topic for today is gas and gas pain, the diseases behind our gas and gas pain. Remember, nothing just happens. In every circumstance, whatever signals or indications that your body may give you, there's something behind every symptom. So we should never, never ignore symptoms. There are some symptoms that may come and go, only to give you the opportunity to do something for yourself. But if you just take some medications to suppress the symptoms, you're gonna miss that opportunity. Gas is something that is a clear indicator that something is wrong in your digestive system. You see, in summary of what we did last week, that is summary here, is that, you see, it is very natural for us, for every human being, to release gas in a form of belching or burping or flatulence. It's very natural. When we eat, we process the food. Even when we drink something, we process that drink. And in the course of the processing, there's some gas that are really released naturally. And we need to, it could be burping or belching or some farting a little bit or flatulence. It's very natural. But these gas, passing this gas through the mouth or through the rectum should have a limitation. As the saying goes, too much of anything is bad. So if you have a lot of flatulence in the course of the day, you got to know that something is wrong with your system. All right? So normally research has shown that between 5, maybe 4 to 12 times, it is said about 15 times bad. 15 times is just way too many in the day. So if the less the better in the day. Somebody going to say, doctor, why are we talking about something that is a bit more sensitive? You know what? You need to hear this. You need to understand this. Lack of knowledge, my people perish. Without the right information, remember, you will go through deformation. It's very important for you to understand everything. Now, let's go on here. It is very important for us to take note of that. The less you have in the day, the better. Normally, you see the intestinal gas. They are odorless. They don't have any scent. These are oxygen, carbon dioxide, nitrogen, hydrogen, methane. They are within the body. But you see, what happens is that bacteria in the system may mix up with this gas and then cause that smell that may come out. Right. So then if we eat and our digestive system is good, we don't give chance for bacteria to be active, to play around our food. No way. We shouldn't give that chance at all. Now, what happens is that if your digestive system is not all right, you may see the following signs. That is, if somebody that got gas problem. If you got gas problem, it means you got a digestive disorder. It's very clear. Now, burping is one of them. To burp or belching. That's when you have gas coming out from your mouth. Right. And then passing gas through the rectum, of course, is flatulence. Is a clear symptom. And then, of course, after eating, you may easily, when you eat a little bit, you feel easily full. There's a distension. Your stomach or your belly will be swollen. Right. It will be swollen for you to know that your food is now well digested. You see, what happens is that, lovely listeners, whenever we eat, naturally, it should take about 3, maximum 4 hours for whatever we've eaten to leave the digestive tract. If the food doesn't leave the digestive tract, I mean your intestines, and it goes on to your colon, your large bowels. And then your brain signals the bacteria there to work on that food, to digest it for you. But if bacteria come in to work on your food in your large bowels, on your colon, they may try to swallow some of this gas. They may try to do everything to reduce the gas, but in doing that, they mix up with that, and you pass out very serious gas, right? Serious smell, okay? And then very frequent in a day to tell you that your digestive system is definitely wrong. Something has gone wrong somewhere. Nothing just happens. Last time, we also said that apart from these observations, if you have the following observation on top of what I've told you, belching, flatulence, and stomach uh, distension, it means bloatedness. If you open your bowels and the stool is fatty stew or bloody stew that got, I mean, the kind of yellowish, greasy looking, and it got a strong smell, it's not a good sign at all. Then you see that there's a bowel movement. There's a changes in frequency of bowel movement. Okay, you may constipate here and there, and then you may see that you are losing weight. Losing weight, not that you planned for it. You didn't plan for losing weight by losing weight, and then persistently you feel nauseated. You feel like vomiting all the time. If you got all these symptoms, it's quite serious. Plus what I've just told you, then it's a matter of emergency. Okay, so let's take note of all these symptoms. Now, we did mention about the causes. The causes of behavior, certain practice, certain behaviors can actually lead to production of gas and also gas pain. What are some of the behaviors? Well, when we are eating and then we talk too much, there are some individuals, they talk while eating. When you do that, when you talk too much, you swallow a lot of, air, a lot of gas, gas into you already. And so that is very common. So when we're eating, we shouldn't talk too much. Okay. So that's a behavior that we should pay attention to. And also, we shouldn't eat too fast. So eating fast can also produce gas. Why? Eating fast means you wouldn't chew well. You don't masticate well. And so it would definitely your body, your enzyme, the enzymes and the acid will not act on your food well properly to digest your food, and that can lead to gas. Also, eating too fast. There's some people that may take just about 5 minutes, 10 minutes maximum to eat their dinner because they don't have time. But you see, food should be enjoyed. You should take your time to chew, to do the mechanical work in the mouth. That's the only opportunity. You have the a say over it. You have a command over that mechanical part. Chewing, chew slowly. Take your time. In fact, it is said in natural medicine that you should drink your meal. So every food, although you are eating solid food, you should drink it. It means chew to the point that you can drink it. All right. That is very important. So we shouldn't eat too fast. And then another thing is a food combination. Example that people may put fruit like berries, strawberry, blueberry, and banana into their porridge. That's very serious because the digestion of fruit is 1 hour and the digestion of regular meal is 3-4 hours. So when you put the two together, it's very serious. Fruit will interrupt the digestion of your regular meal, and that will cause a lot of gas. Now remember, when you're producing gas, it's not only gas that you're producing toxins, poisons into your bloodstream that will get into your body, your joints. And you have pain here and there. All the time you feel tired, pain here and there, headaches. You don't know where it's coming from. And then you will go and take painkillers that will kill your heart tissue and kill your liver tissue, your kidney tissue, and your gastric system. So beware. Look at where the problem is coming from. Trace and track the problem. It could be indigestion. producing toxins into your bloodstream. That's why you keep having headaches and body pains. So that's why it's very important for all of us to, from time to time, cleanse the body. I ask somebody, when did you last cleanse your body, organ system, your blood system? Many people have no idea how to cleanse your blood system and your organ system. Others say, doctor, I cleansed my large bowels some time ago, but it's not blood. It's not, getting anywhere. Anyway, it's very important. Now, other behaviors like we overeat. When you overeat, your digestive juices may be less, or acid in the stomach may be less. So you may not, they may not be able to act on the food well. So it's very important for us to be 80% full. 80%. If you're 80% full, it's great. It's really great. And then it can enhance your digestion. And the behavior is, if somebody makes you feel angry or sad, or you are unhappy in a way, or you're emotionally disturbed, and you sit eating, you're going to poison yourself because you can't digest your food well, produce a lot of gas. So be happy, be a happy eater. And that circumstance, that's the only way your body can release the enzymes and the proper amount of acid in the stomach to digest your food. There's another behavior, a practice, that they say sweets after meal. It's never true. It's sweet before meals. So you eat sweet because we have six tastes. And sweet, the body digests sweet first among the six tastes. So you eat sweet first and then you eat your regular meal. Then your food will digest well. I hope it makes a lot of sense. Now, let's now address the diseases behind our gas and gas pains at this point. But before I address that or I talk about that, let me put this number on the platform. Maybe you don't have gastric problems. You have different problems. You have some chronic problem disturbing you. Diabetes, heart problems, hepatitis. You have infertility problem. You have premature ejaculation. The man that you go on the road, we take the first step, and it's over with you. Your wife will never be happy with you under this circumstance. Never be happy. So if you have a premature ejaculation, you have a solution actually waiting for you. Skin problems, okay, hair loss. If you have any chronic diseases, osteoarthritis, regular arthritis, rheumatoid arthritis, just call this number. It may not be you, it may be somebody suffering. Be a blessing to that person by sharing the number, and God will bless you too. This number calling outside the UK is +44 738 464 7300. Calling within the UK is 0738 464 7300. This number is WhatsApp. You can WhatsApp me, you can call me for us to discuss. I'll be very happy to talk to you about everything. And that's a solution to your problem by God's grace. All right. But now let's come to the diseases, the disorders behind the gas. We've spoken about behaviors, but what about diseases? So giving out gas, belching all the time abnormally, and passing, this farting around can indicate that there's a disease, or there are some diseases that have already started or about to start. Let us think carefully and understand this. Now, let's talk about some disorders first here, about food intolerance. There are some individuals that cannot tolerate, for example, milk, because they don't have the right enzyme called lactase that will act on the milk to break it down. So we call them lactose intolerance. But you see, we should be able to tolerate everything. But if you're not careful, you start with one intolerance, you go to the next intolerance, you go to the next one. At the end of the day, you realize you have even nothing to eat. Nothing to eat. There was a lady that came to me, 20 years old, had a very severe intolerance to almost every food. She was able to eat only strawberries because she had her IBS, irritable bowel syndrome, very serious one. 10 years going to the hospital, nothing happened, right? But by God's grace, she's fine now. The food intolerance can create gas, a lot of gas, right? So the certain food that you may eat that your body cannot digest because you don't have the enzymes, the chemical to break it down. You produce a lot of gas. And the bacteria overgrowth. It means that here. What does it mean? You see, in the small intestine, we have certain bacteria that is there and limited. They're specially created. But then if your digestive system is not working well, then we could have other bacteria coming from somewhere, for example, from the colon, your large bowels, that could get into the small intestines, and that can cause what they call the bacteria, small intestinal bacteria overgrowth, Sibo, right? It can cause that, and that can also lead to gas formation as well. So Sibo is another health disorder that you can produce gas. Constipation. Some individuals will say, I don't open my mouth 10 days. Very serious. Or in a week, maybe I have about 3 times constipation. You should never constipate. Every day you should be able to open your bowel, because if you constipate, you produce gas. And anybody that produces gas abnormally in the day, you produce toxins. So your bloodstream will be filled up with poison, and poisoning you, getting into your joints and causing inflammation. And inflammation, is the basis of diseases. So if you keep poisoning your body, constant inflammation, anything can happen. And remember, nothing just happens. Now, we come to also certain diseases, also other diseases that we should take note. And the diseases, they got big names, but let's simplify them here. We have a disease called Irritable Bowel Syndrome, IBS. And this is the changes in the frequency of your bowel movement. So you may have abdominal pain. So irritable bowel syndrome is another disease that can produce gas. Produce gas is another point. We should take note. Crohn's disease. Crohn's disease is a type of inflammatory bowel disease. It can affect from your mouth to your rectum, affect any part, but mostly it affects the small intestines or the large bowels. It's very serious disease that normally when people go to the hospital, they cut their intestines. They just reduce it, and these people end up dying. They grow very old quickly and die. This is Crohn's disease. It's very serious, a life-threatening disease. So it can also lead to gas formation. And then we have what I call the ulcerative colitis. When you say ulcerative colitis, it's just inflammation of the large bowels and rectum, or only just the colon or the large bowels. So when that area is inflamed chronically, you can also produce gas. We have also peptic ulcers. When you talk about peptic ulcers, we have 3 types. We have gastric ulcers. The gastric ulcers, they develop inside your stomach. That is gastric ulcers. And then esophageal ulcers. That is the tube connecting your throat and your stomach. So we can have ulcers there, and that can also produce gas too. And the duodenal ulcers, this develop in the upper section of your small intestine. This upper part of your small intestine is called duodenum. So when you have ulcers there, that can also show itself in gas formation, frequent gas formation in the day. Diabetes is everywhere. So diabetes can also cause serious digestive disorders, producing gas. Diabetes is something that type 2, you can reverse it easily. And the borderline diabetes, you can reverse that immediately, not to cause complications in your life, damaging your eye, causing blindness, glaucoma, cataract, damaging your kidneys, and causing stroke, heart attack, and so on. Not only gastric problems. So diabetes is not about sugar control in your blood. It's not about that at all. It goes way beyond that. It's about your body not responding to the insulin to open up your body to make use of the glucose, right? And then we have a disease called scleroderma. Scleroderma is just autoimmune disease or disorder, that actually causes the body to replace with a thick tissue with the extra collagen. The collagen is a material that helps the body not to wrinkle, but it could form a lot in your body. It can affect anywhere in the body. You see, so we have these diseases that we shouldn't actually joke. We have what is called intestinal obstruction. Intestinal obstruction, that it just means that those that have undergone belly operations, abdominal operations, hernia, for example, if you go through surgery in your abdomen, normally it can cause intestinal obstructions, and that can even block the flow of gas through your intestines, right, and give you gas pain, and also give you a lot of flatulence or frequent gas release, right? So it's really important to avoid, in any case, surgery on the abdomen. Lovely listeners, today we have educated ourselves. We have opened our understanding. Don't forget to tune in every Sunday live. A new topic. Don't miss at all. And visit me on YouTube. Put in Dr. James dash Natural Link. Dr. James dash Natural Link, and subscribe, like us, and please subscribe and support the program and share the presentation there. Be a blessing to someone, and God will bless you. Thank you very much. May God Almighty smile upon you this coming week. Thanks a lot for joining me on this platform. I will have another beautiful encounter with you next week, Sunday. God willing. Goodbye for now. Goodbye.